Okay, so let's take a look at the different types of patients for an implant reconstructive procedure. So the patients are kind of into three different categories. We have the patients who have periodontal disease, where their bone and the tissue is inflamed and the teeth have to be removed. And then also we have patients who have decay, where the teeth can't be saved due to breakdown of the dentition itself. And then 3 are biomechanical issues, meaning they've lost their molars. And so now all of a sudden, the forces are transferred to the front of the jaw, and the wear and tear on those front teeth is taking its toll. Usually it's a combination of the 3, where you've got periodontal disease involved, you have decay, and biomechanical issues. The goal is to restore their mouth back to normal, natural function, to where they can chew and eat as they did prior to losing their teeth. And also restoring those teeth to the beautiful aesthetics that their teeth were prior to the decay and also the periodontal disease. And so those are our goals in restoring a patient who has lost teeth, broken down, their mouth is breaking down or broken down, and we're having to reconstruct their mouth back to perfection. And so let's take a look at this case. So this is a patient who has all 3 of these factors. You'll notice that there's decay, periodontal disease, and also they're missing teeth. And so the wear and tear on the incisal edge of their tooth or teeth is now to the point where everything has to be removed. And so if we look at here, we have the before photo where you can see all of these things going on, but take a look at the after. And I don't want to get into all the details of the reconstruction of this case, because it can be quite involved, and every single patient requires a personal approach to reconstructing their mouth. But let's take a look at his after photo. And you can see how we have now restored facial aesthetics, his smile, vertical dimension, how the jaws relate to each other. So all of those things are now restored, and they're permanently attached to his mouth, so he can chew and eat and smile and not have to worry about his teeth like he did previously. The goal will be to have him develop habits that can maintain these so that he doesn't have any of these issues in the future. Okay, so that's the first type of patient, where the patient just needs all of their teeth removed and basically a fresh start, which is a wonderful thing about dental implants. It's basically like our 3rd set of teeth, because we have our baby teeth and then our permanent teeth. And when those go, now all of a sudden, either you're in dentures or you get implants. Now let's take a look at this other case. Similar situation. She's got periodontal disease, not as bad as the first case, decay, but this is an absolute case of biomechanics. If you look at this picture, this photo, you can see the wear and tear of her front teeth. Because she's lost her molars, those teeth have just worn down, and they've worked hard to try to get her through normal natural function of chewing and eating, but now they're just like, okay, I give up, and they want out. And you can see, look at the beautiful aesthetics of these teeth. We have restored now the function of her entire mouth with zirconia, so fixed zirconia prosthesis on the upper and the lower, and we can see now her after smiling shot, and look at how it just transforms her face and how beautiful she looks now with her smile restored. So these are the patients who come to me and they need their mouth reconstructed, and it's kind of like I'm starting with a clean slate, so to speak. And then there's the category of patients who have already gone through the process. And these are the ones I feel most for, because they've tried, they've taken the initiative, they've gone and they've had the work done. And so, but it didn't work out for them. So let's take a look at this patient here, who she had this work done at a previous office, and about a year later, everything started to fall apart. And this is why I am so adamant about, if you're having this procedure done, all-on-4 is really not for anybody. It's a procedure that was developed in order to kind of simplify the surgical process without really thinking about the prosthetic or the biomechanics of how the mouth is supposed to work. And so you'll notice here she's missing a whole section of teeth in her mouth. And this was a case that was done recently. It wasn't that long ago. And so take a look in the inside of the mouth. You can see, she's got implants, but the prosthesis has failed. So the implants themselves have not failed, but the distribution of those implants, where they're placed in relation to the prosthesis or the teeth, is not accurate. And as a result, again, she's chewing on her front teeth. She's having to use the prosthesis like she did before she lost her teeth, and just all the forces are in the front. And that's why I don't like the all-on-4 procedure, because all of the implants are concentrated in the front of the jaw, both the top and the bottom, and then they angle the implants at extreme angles. And so that implant distribution is not favorable to long-term success. So you can see here, this is a complete catastrophic failure. The case has to be redone. It can't be repaired or fixed. And so what we did was we went ahead and we placed additional implants so that we could give her that support in the back of the jaw and take the load off the front of the jaw. Here's the prosthesis out of the mouth. And you'll notice here there is a big cantilever off the back side. Or they stay away from the first and second molars, and they don't include those molars in the bridge or in the prosthesis, which is crazy because we need those molars, because it puts so much load on our front teeth when we don't have the support in the back of the jaw. Again, this is why I do not like the all-on-4 procedure, because biomechanically it simply does not make sense. The surgeon, and usually there's 2 doctors involved in the process, the surgeon will place the implants in the premaxilla, in the front of the upper jaw, and not place any implants in the back of the jaw. And then the restorative doctor is basically kind of dependent on the position of those implants. But what they do is they'll remove usually definitely the molars, the first or second molars, take it out of the equation, so out of the bridge itself, and now you're chewing again on your front teeth. Putting implants in the back of the jaw, having an implant in those first or second molar positions, now all of a sudden you've changed the dynamics of the bridge. You've changed the dynamics of how this functions. And you can see that the bridge is broken here. And so now let's take a look at her after photo. And you can see now we have restored her back to normal, natural function. Aesthetically, it looks beautiful. But more importantly, the back of the jaw now has the proper number of teeth that she had prior to losing her teeth. And this is why I love the all-on-6 procedure, because we restore the patient's mouth back to the original state before they lost their teeth. And so the all-on-6 allows us to have proper implant distribution so that the biomechanics and how the case functions is more favorable, so that the load factors are not so out of whack that it causes the prosthesis to fail or implants to fail. So these are patients who have been through the process and now having to go through it again. Let's take a look at this x-ray here. This is actually a case that patient went through the process. We had to actually remove all of these implants because there was peri-implantitis, there was bone loss around each of the implants. So we had to take the implants out, put in all new implants, and make her a new prosthesis. If you haven't been through the process, or if you're considering the process, I mean, this doubles the cost of the case because we're having to do it again, and this patient had paid once before. But notice the distribution of implants. You can see with the all-on-6, I have implants placed, 6 of them, very evenly, and it goes to the back of the jaw so that the patient can now chew in the back and have support by implants in that area. Versus the all-on-4, everything is concentrated in the front of the jaw. So this is a great example of an x-ray that demonstrates how the difference between the all-on-4 versus the all-on-6. Okay, here's another case. Patient had all-on-4, upper and lower, and not only did the prosthetics fail, but all of the implants failed. And you can see in this x-ray, we had to place additional implants in the patient's mouth, but it was just a mess. We had to regenerate the bone. We had to do all kinds of stuff in order to get the patient implants again, because they didn't want to end up in a denture, because that's why they went through this process to begin with. They wanted implants, they wanted teeth that were permanent, and they did not want to be in a denture. And they went through that process, but unfortunately, the materials that the doctor used were not great. And so as a result, a few years later, they ended up back in my chair where they were having to redo the entire case. And so this x-ray, it demonstrates, kind of an image of the patient went through the process and now is going through it again. So here's another patient who, same thing, had lots of implants, different implants from different manufacturers, different doctors, and she was always directed by her general dentist, who would send her to a surgeon. He would place a certain type of implant. A few years later, they would do another extraction graft implant, and then this guy would place another brand or type of implant, and then ultimately ended up in my office. And you can see, here's the before photo. So take a look at this. The bridge is falling apart, but look at this metal here. Look at how it's tarnished. It's actually there, so the type of material used on the framework underneath the bridge, who knows what that is? I mean, whether she's getting like a galvanic shock or reaction, and a chronic one, by the way, because it's chronically, with galvanic shock, you get this chronic kind of electrocution in the mouth because it's a wet or aqueous environment. And so any sort of metal is very reactive in the mouth because it is a wet environment. And so, and of course, the prosthesis is falling apart. She does have periodontal disease. She's got all kinds of stuff going on. And so this case has to be redone. And that's exactly what we did. We went ahead and we took out the prosthesis. We had to remove 2 implants and place new implants and reconstruct her entire mouth. But take a look at the after photo. And you can see her mouth is now relaxed, her face is relaxed, her lips are relaxed. When she smiles, it looks natural. But more importantly, the way it functions. And even more important than that is the fact that it's secure long-term, because the position of her implants now are such that biomechanically this will work out perfectly. And so, take a look at the prosthetics itself. So this is a zirconia prosthesis. So this is a prosthesis or a bridge that we do here at Trust Implants. We don't use any titanium frameworks or hybrids or plastic or any of that stuff. We only use zirconia. Why? Because I want my cases to last. I want this to last the rest of this patient's life. And more importantly, it protects their investment. It's an expensive procedure. I don't care how you do it, who does it or how you do it. There's costs involved. And so the type of implants we use, the materials that we use, help to protect the patient's mouth so they don't have to go through this process again. Once we do a case here, that's it. They don't have to deal with any issues in the future. And just take a look at the difference in the prosthetics. So here's a case that we had to take out and redo. And look how dirty and how tarnished this metal is. So this patient had no idea the type of metal that was put in her mouth on this hybrid. So this is a hybrid of some sort of metal and plastic. Of course, the plastic broke off the metal piece, and now she's left to have to redo this case. And you can see that. You can see how tarnished the metal is. You can see where it's broken. You can also see how much debris is collected to this framework. And with zirconia, you don't get that sort of collection of debris. It kind of pushes the debris away. It does not adhere like plastic adheres a lot of debris. Titanium a little bit less, or whatever this metal is, a little less, but zirconia is much, much less than either. And so that's another reason why I like to use zirconia, because it does not adhere bacteria, plaque, or any of the things that can cause problems with your implants or the bridge itself. And look at so let's get into the details of the prosthetics. So if we were to, magnify where the gum tissue and the implant and the prosthesis all meet together, that area has to be very precise. And the materials in that area, it's the most important part, because that is where problems can arise. It's not necessarily at the edge of the front tooth. It's down deep where the implant and the prosthesis and the tissue all meet. And so that's where the materials used in your case or in a case are very important. You saw on this slide, on the previous slide, how the tarnished all the debris that was collecting there. But I can guarantee you with this slide here, if I were to take this out after a year, it would look much different than a titanium framework. So these are all factors that have to be considered when doing these sort of cases. And you don't, as a patient, you don't know that. There's no way for you to know what materials are being used in your mouth, what implants are being used, what brand of implants, and then what type of prosthetics. What are the materials that are attaching the prosthesis to the implant and vice versa. So, and these are important topics. They're important factors that really nobody's talking about. All they're talking about is doing all-on-4. And we can do all-on-4 and you come in and you go out in a day and you're happy and you're good to go. But that's really not the case. It is very much more technical and involved than just going in, putting in 4 implants and coming out with a new smile. So it's critically important, the materials, the type of implant, the type of prosthetics, the type of graft material that the doctor uses. You know, like these images here showing patients who have already gone through the process and now having to go through it again. Take a look at these images and you can see how there was no rhyme or reason, no planning. The doctors were just putting in implants all over the place, and now the patient suffers because they have to go through it again. So my advice is to, before you go through the process and reconstructing your mouth with dental implants, visit trustimplants.com to gain some information. Follow us on YouTube at Trust Implants. Watch the videos and develop enough information so that when you go in for a consultation, you can be armed with the information that you need so that the outcomes will be as you expect. Remember, you won't know what the final prosthesis or teeth feel like until it's done. There's no way to know that. In order to minimize complications down the road, make sure and do yourself a favor and get enough information so that when you go in for the procedure, you know exactly what materials are being used and you have an idea what the outcome will be. I'm Dr. Willardsen. Visit us at trustimplants.com and subscribe to Trust Implants on YouTube.